Hello, today I'll be performing a focused musculoskeletal assessment on a 26-year-old male who has presented with aggravation of his left shoulder. The onset of pain was gradual and occurred whilst out shopping. The pain has been ongoing for the past 12 consecutive days. The patient rates the pain at a 6 out of a possible 10, with 10 being the worst pain they have ever experienced. And upon assessing his heart rate, blood pressure, and respiratory rate, there were no abnormalities found. The patient is currently not taking any medication, nor does he have any allergies. He also has no significant family history. He does, however, have reports of dislocating his left shoulder whilst playing basketball in 2010. Despite this, he is said to have fully recovered and had no ongoing issues. Due to the nature of the patient's current pain and his past injury to his left shoulder, I have decided to conduct a musculoskeletal assessment. This assessment will determine his range of movement of his upper limbs through the use of flexion, extension, abduction, and adduction. I will also be able to identify any limitations in strength as well as detect any abnormalities. Hello, my name's Tani and I'm a first year nursing student from Swinburne University. How are you today?
Pretty good, thanks.
That's good. Okay, before we start, can I just ask what your name is?
Yep, my name's James.
James, and when's your birthday?
10th of March, 93.
Beautiful. Okay, so James, today we're just going to be doing a shoulder assessment. So that will involve me having a bit of a look at your shoulders. We'll also have a feel around your shoulder joints. And after that, I'll ask you to put your arms through a range of movements. Does that sound okay?
Sounds fine, yeah.
Perfect. So James, before we start, do you have any pain in your shoulders at all at the moment?
A couple of weeks back, I hurt myself playing basketball in my left shoulder at the top here.
Yeah.
So that's been kind of giving me an ache for a little while.
No worries. Well, we can definitely have a look at that today. All right, so I'll get you to hop up and take your shirt off and we can begin the examination.
Sure.
To start with, I'm just going to have a look at the symmetry of your shoulders. Okay, I'll just get you to relax your arms, face your palms forward for me. Perfect. And just turn to the wall on your left-hand side. Yep, and turn left one more time. And just around to the last wall. That's perfect. So to start with, I'm just going to have a quick feel around your clavicles. Is that okay?
Yeah.
Yeah. I'm just going to have a feel down your clavicle to the head of your humerus. There's no pain there?
No.
No worries. Alright, we'll just do this side as well. There's no pain there either?
No.
No worries. And I'll just get you to turn around. So I'm just going to have a feel down here as well. Any swelling? Okay. And just a little bit more pressure. There's no pain there?
No.
No, just let me know if there's any pain. Alright James, so next what we're going to do is just put your arms through a range of different movements. Okay? So to start with, I'm just going to get you to put your arms up, just straight in front of you, up as high as you can. Okay, and pull them back as far as you can, and behind you. Perfect. Alright, next we're just going to do the same thing, but out to the sides. Alright, so can you pull your arms out to the side, up to touch your ears, and then bring them back down and cross them over as far as you can. That's perfect. Alright, you can just put your arms back down, just relax. So next we're going to do the same movements. However, this time I'm going to get you to be completely relaxed and I'm going to do the movement for you. Okay? So we'll start with this arm. We'll put it up as far as we can. And then we'll put it back. Perfect. Alright. And then with this one, do the same thing. That's perfect. Then just get your arm to lift up like that. And back down. And put it across. Perfect. And one last time on this side. And then back down and back across. That's perfect. Okay, so what we're going to do next is I'm just going to get you to put your hands up one more time. Alright, and then I'll get you to bend your elbows and place your palms as low down your back as you possibly can. Alright, next we're going to do the same thing, however, we're going to place the back of our hands as far up our spine as we can. That's perfect. For the last part of this examination, I'm going to assess your upper body resistance. Alright, to do that, I'm just going to place my hand on your arm. It's going to get you to push up against my hand. There's no pain there?
No.
Perfect. Alright, I'm just going to do this side as well. So we'll do the same thing. I'll put my hand here and just push up. There's no pain?
No.
Perfect. Okay, James, well that concludes our assessment today. So you can go put your clothes back on if you like. So out of all the focus assessments that we've learnt about in class so far, the one that I felt the least confident in was definitely in the musculoskeletal assessment. I think one of the main reasons of this is because there's so many different parts of our bodies that this assessment can be performed on, and each part it is performed on slightly differently. I thought for this assignment I would choose the musculoskeletal assessment to challenge my learning. I believe that the only way that I'm going to become more competent in all of these duties that I may need to perform as a nurse is by getting out of my comfort zone and practicing them as much as possible. Completing this musculoskeletal assessment was a great learning opportunity for me. Rewatching the footage, I was able to identify a lot of areas that require improvement. One of these areas in particular that has been really bothering me is my pronunciation of words and my use of medical terminology. I would really like to expand my academic use of medical terms and also learn to pronunciate words properly without stuttering. Another thing that I noticed that needs improvement is asking my consent from the patient. Although at the very start I did ask for consent, and at each stage of the assessment I did explain what I was going to do, I would be explaining what I am going to do whilst doing it rather than beforehand. I think it's very important to tell the patient what you are going to do before you actually physically touch them, because although at the beginning of the assessment they have given you consent, they may not realize or understand how hands-on the assessment could be, resulting in them feeling quite uncomfortable and even violated in worst case scenario. Something that I really benefited from this assessment was physically touching the patient. I always feel quite nervous that I'm going to palpate too hard or stretch a limb too far. However, performing this musculoskeletal assessment on James allowed me to really test the limits of what our bodies should and shouldn't do. I'm very happy with the outcome of this assessment. I believe that by performing and practicing it on somebody who I knew, it gave me a lot more confidence. It made me feel a lot more comfortable in making mistakes as well as palpating and inspecting the assessing areas. Overall, I believe this assessment was a great learning experience for me. I have definitely become a lot more comfortable performing a musculoskeletal assessment, and I look forward to doing more assignments like this in the future.